In this video, we're going to go over whether your back pain is coming from a muscular issue or it's coming from a disc. Now, I know this is a really confusing concept because most people will get an MRI and automatically assume that their symptoms are based on the findings from the MRI. And obviously, that sounds logical, but believe it or not, oftentimes that is not the case. So many patients will come in and say that they have some type of disc bulge, whether it's L4, L5, L5, S1. And they'll insist that that's the cause of their pain, and we'll do our assessment and quickly we'll find that sure, they have this disc issue, but that's not the exact pain that they're feeling. Guys, so over 60% of MRI findings show a disc bulge, and so it's a pretty normal finding overall, and so we don't just want to assume that your symptoms are from that. So what we're going to do in this video is define the characteristics of a muscular issue versus a disc. So stick around until the end of the video to see which bucket you fall in. If you didn't know, guys, my name is Dr. Joe Ruskowski. I'm a physical therapist and owner of Identity Physical Therapy in West Orange, New Jersey. And if you find this video helpful, please subscribe to our page to see other videos just like it. So to understand discogenic pain, we first need to know what a disc is. So we're going to use our good friend here. Now, he might look like the old skeleton that we have, but actually he's a new one. So if you have a name for him, you can leave a name in the comments. Anyway, what a disc does is it acts as a shock absorber and allows for smooth movement in between the vertebrae. And you can see the discs all here. The disc wraps around 360, so it's in the front and the back of the spine. Now, if you see here, this red is actually like a fake example of a disc that's protruding. You can see if that red disc is protruding, it's gonna hit on this yellow nerve. And in the model, the nerve is cut off, but really the nerve runs down and all down the leg. So someone who has true discogenic pain or a herniated disc that's causing their issues, they're gonna typically have significant tingling down their legs or actual weakness down their legs. And it's not the weakness where you feel like, like, oh, I haven't been to the gym in a while, my legs aren't strong. It's genuine weakness and where to the point of you almost can't control your leg. Okay, the other thing that you might have, especially if it's in the early stages of the disc bulge, is actual sharp pain directly in the center of your back. So if you're saying that your pain is sharp right here, then chances are you might have some disc involvement going on that hasn't pressed up against a nerve just yet. Now, while that definitely exists, guys, I will say it's a much, much less frequent diagnosis or appropriate diagnosis than what's actually given. So many times people, like we said, will get their MRI, it'll show a disc bulge, and they will blame it on that. But what we really need to talk about is more of the muscular side of low back pain. Oftentimes when people have muscular low back pain, what they'll say is that their back is tight and hurts in here and then runs out to the side. Guys, that's actually the low spine, the muscles around the lumbar spine, and then into the pelvis area. So if we do it on our unnamed skeleton, that's pain in here on the side of the spine and then down into this pelvis region and across the hips. Now, the reason for this is because of our modern lifestyle, you're so susceptible to getting pain like this. The reason why you're so susceptible to getting pain like this is because our body craves rotation, specifically rotation in the pelvis. And with our lifestyles, that involves a lot of sitting, or even people who go to the gym a lot, it involves a lot of like heavy bilateral lifting, so lifting the same on both sides and really kind of lifting a little bit robotic and not having any rotation happening. What that does is it ultimately stiffens up your pelvis, which results in also your spine getting stiff because your spine directly connects to your pelvis. And so oftentimes what this will feel like is stiffness that becomes so significant that it becomes this constant ache. And what some of my patients will tell me is that it just feels like they want to like stick a elbow deep in it or punch the spot, and that's that deep ache that they're describing because what's happening is the muscles around the area are losing their ability to contract and stretch, and so they're not getting the blood flow that's required to prevent it from aching and keeping it healthy. So what I find is this is far, far more common. Roughly 80% of low back pain is mechanical, which means it is muscular, and there's a movement explanation to explain why you have it. All right, guys, so remember, your MRI does not tell the full story. Your MRI is just one picture at one moment in time and does not explain how you're moving functionally. So if this video was helpful, please, as always, like, share, and subscribe, and I look forward to seeing you at the next one.